a smaller hospital, but that doesn't necessarily mean lesser quality.
UnityPoint has really given a lot of support to the patient experience and training us to be sensitive to not just ordering the right tests and providing high quality of care, but providing a high quality experience. And there wasn't really a significant effort to support that endeavor in the past. I think we're trying to engage people at all levels with all types of different problems, whether you're here for a head cold with your little kid or your loved one who is going into comfort care, and the wide spectrum of different things that will come in our door. We're trying to meet every patient where they're at and make sure we're meeting their needs and being sensitive to that and not just the test that needs to be done.
We have developed a lot of competencies and education for our staff. We feel like our staff need to have the tools and equipment to do their job. We also communicate the why. We're following the regulatory guidelines and what's considered best practices and the metrics for emergency services to provide the best care to our patients.
Everybody needs to understand that healthcare is changing, but I think sometimes there's a rush to blame UnityPoint for some of the financial difficulties that this hospital has had, but it's not their fault. The entire medical environment is changing, and all you have to do is look at the other states who are our neighbors and see that hospitals our size are having to make similar decisions about closing service lines that we just can't support and supporting other ones that we can. In a similar way, if you want to have good services here to get your knee arthroscopy or your colonoscopy or your hernia fixed, you need to keep as much of that in town as you can, or this hospital system won't continue to be successful. And so it's critical. We want all of our friends and our neighbors and people who live in central Iowa to feel like they can come here, get all of those emergency problems worked up, stabilized and managed with expert level care, and then we can recruit help once we determine that we need it.
All of our ER staff, the providers, nurses, EMS, they're all certified in advanced life support. They do such a wonderful job. In the past 2 years, with changes in hospital ownership, came changes in leadership, expectations, and they've just been super adaptable. They roll with everything that we're rolling out. I think it was very evident last year with the tornado and moving the emergency department. The group is just resilient, they're hardworking, and they're really striving to provide the best care for the community, and they're very engaged in processes.
I think all of our staff were proud to serve our community and be there in the moment when they needed us.
Here at UnityPoint Marshalltown, we're here to provide emergency services. We treat and rule out life-threatening emergencies every day. That's what we do. We prioritize the care of the patients, and we're here to take care of our community.